Hi, I'm Maury DiPaolo. I'm the Healthcare Practice Director for Edgewater. We work with a variety of healthcare clients, organizations large and small, helping them achieve their objectives through the use of IT and data systems. One of the common challenges that we find with our healthcare clients today is, what are we doing around population health management? How can we get better control of our patient populations? How can we measure the performance of our organization to achieve the goals, both in terms of clinical outcomes and financial results? And how can we make more intelligent use of our data systems to accomplish those objectives? One of the first questions they'll ask is, well, who are our patients? And what they're really asking is, who are the groups, what are the homogeneous sets of patients with shared characteristics that we can begin to focus and target? Whether those are disease characteristics, resource consumption, utilization pattern, or even financial results. Then they want to baseline their performance to say, how can we begin to understand what kind of improvements will be possible with those patient populations? And then who are the new partners that we need to begin to coordinate and collaborate with? And this really can reveal new needs for different models for accountability. Now, it's seldom the case that any healthcare organization is going to follow those steps in strict sequence. Much more likely is they're going to go into a continuous improvement process, cycling through and modifying their process along the way. The first thing they need to do is to identify and stratify patients into appropriate groups. That might be based on disease characteristics or treatments that they're receiving. The next is to be able to design care plans that are tailored specifically to their needs and to coordinate the delivery with community providers and all the resources that are available. And with the right information system strategy, you should be able to look at your information in a variety of different and useful ways. The first display of data is simply to look at what's the composition of the population that we're measuring. In this case, we're looking at diabetes patients and their accrual over several quarters. One of the first things that we'll want to know is, how is that population composition changing? And we can do that through segment analysis. So what this shows is patients that are either new in the population or even new in the segment of focus, as well as patients who were previously in that segment. More sophisticated analyses are also possible. Here we look at the distribution of the population in terms of how long they've been on the care plan, and we can see a breakdown in terms of how well they're adhering to the care plan. And here we see a correlation between the patient's compliance to the care plan and the effect on their hemoglobin A1C value. Clearly, the more compliant they are with the plan, the more of an impact it's having on their decrease in their A1C over time. So when it all comes together, what the organization is really committing to is a two-stage process: application of analytics and then mobilization of the resources to respond to what those analytics are telling you, all to the benefit of patients and the populations you're serving. To learn more, please visit our website at edgewater-consulting.com. Thank you.